Hello everyone, I'm Laverne McGee. Welcome to BNC News. I'm here with Fred Hickman. The United States has more than 266,000 confirmed cases of the coronavirus, and that leads the worldwide tally of more than 1 million people, and that study compiled by Johns Hopkins University. And breaking news today out of the White House, anyone who will be in close proximity to President Trump or Vice President Pence will be given a COVID-19 test starting today.
Hi, Laverne. There are some new strict guidelines being put in place, and that's in light of the fact that there are some 6,800 deaths that have occurred because of the coronavirus in the United States. 6,800, and almost 3,000 of those have taken place in New York City. Also announced today, the CDC is going to recommend that Americans wear some sort of facial covering. As the president is calling it, it's a voluntary measure.
The transmission from individuals without symptoms is playing a more significant role in the spread of the virus than previously understood. So you don't seem to have symptoms and it still gets transferred. In light of these studies, the CDC is advising the use of non-medical cloth face covering as an additional voluntary public health measure.
CDC, the World Health Organization, my office, and most public health and health organizations and professionals originally recommended against the general public wearing masks because based on the best evidence available at the time, it was not deemed that that would have a significant impact on whether or not a healthy person wearing a mask would contract COVID-19.
The new guidelines are encouraging people to use more rudimentary coverings such as t-shirts or bandanas or any kind of a non-medical mask because the medical stuff, that's what our health providers need. President Trump himself suggested scarves could be a good alternative. Some people already have started to buy or create face masks of their own, and it's expected to be limited to people in areas of the country hit hardest by the coronavirus, not nationwide, as some health experts have urged.
Fred, you still there? Can you hear us?
Oh, yes, I'm here. I'm very sorry. I apologize. This distancing from home is
yeah,
a little
this
bit
is
difficult.
It's kind of tough.
Some of the new recommendations. It is, but that's okay. We're playing it safe as we should. But the N95 masks, and I guess we should stress this importantly, those are what our doctors and our nurses and our health professionals and our first responders really need. But the point is to just kind of protect yourself if you have to go out. And you shouldn't go anyplace unless you're going to the store or the pharmacy or someplace you absolutely have to be in attendance at.
Absolutely, Fred. We'll see you in just a bit.